Hello, everyone. Thanks for joining. Welcome to our Learning Exchange series for our CEDER, the National Center for Engagement in Diabetes Research. Just going to wait a little bit as people sort of trickle in, and then we'll kind of get started to try to keep on time as best as possible. I am Earl Chambers. I am one of the three MPIs of CEDER, along with Nadia Islam and Arlene Brown. And we are presenting to you today our Learning Exchange Sustainability 101, Best Practices and Tools to Sustain Community-Led and Informed Research. We can go to the next slide, please. Again, next slide, please. Great. So I'll give you a brief overview of the agenda today. I'm going to start with a little bit of an overview of CEDER and what the Learning Exchange series is all about. And then I will present our speakers for today, Dr. Rachel Shelton and Dr. Joshua Joseph. And then I'll end with some closing remarks, and Emma will lead that and give you a couple next steps for what you can expect from CEDER and the Learning Exchange series moving forward. Next slide, please. So the CEDER goals. So along with our learning exchanges, CEDER provides a number of different services with the overall goal to provide resources and technical assistance to promote engagement in diabetes-related research and programs. The overarching vision of CEDER is to foster community-led and informed diabetes research for all communities by integrating multi-sector engagement across the research spectrum. If you're interested in contacting CEDER for services related to consultation studios or getting more information around our learning exchange series, please use the QR code. That's very easy to sort of get access to all the information you might need. So hopefully you will find all these services useful, and they are free to utilize. So please take advantage of that. All right, next slide, please. So our Learning Exchange series, as I mentioned before, is one of many services that CEDER provides. The goals of the Learning Exchange series is to share examples and best practices of positive research community partnerships that highlight community engagement in type 2 diabetes research and programs, to overall increase our understanding and expertise around policy, communications, grant writing, community-based participatory research, and other topics. The participants, we have a large partnership hub of members and clients, and any individual interested in type 2 diabetes research and community engagement, and NIDDK funded individuals and groups are also considered participants and welcome to join. Next slide, please. So this is what our 8th learning exchange series, I think. Our prior learning exchanges have included topics like best practices in community engaged research. We've had some on data visualization and data mapping, participatory budgets, and you can see here just some examples of what we've been doing. If you're interested in any of our prior recordings from our learning series or our learning exchange series, you can click on that YouTube link there, and they're all available for viewing. So we hope that you will take advantage of that as well. Next slide, please. Okay, so brings us to today's webinar. So as I mentioned before, Sustainability 101, Best Practices and Tools to Sustain Community-Led and Informed Research. We have two speakers today, Dr. Rachel Shelton and Dr. Joshua Joseph. I will briefly introduce them both, and then I'll hand it over to Dr. Shelton to start the presentation. All right, so Dr. Rachel Shelton is a social and behavioral scientist with expertise in implementation science, sustainability, and community engagement. She is a professor of sociomedical sciences at Columbia University's Mailman School of Public Health, where she serves as deputy chair for faculty development and research strategy, and is co-director of the Irving Institute for Clinical and Translational Research, where she leads an implementation science initiative across the university. Dr. Shelton taught a course in implementation science for over 10 years at Columbia and has been core faculty for 16 implementation science mentoring and training programs globally. Dr. Shelton has over 16 years of experience leading mixed methods, community-engaged research on advancing the implementation and sustainability of evidence-based interventions in community and clinical settings to address health disparities, especially in the context of cancer, with over 160 peer-reviewed publications. Her work has been supported by numerous institutions, including NIA, NCI, NIMHD, NCATS, and the American Cancer Society. Dr. Dr. Joshua Joseph is an associate professor of internal medicine in the Division of Endocrinology, Diabetes, and Metabolism at the Ohio State University Wexner Medical Center, founder and medical director for the Ohio State University Wexner Medical Center Healthy Community Center, which offers nutrition and wellness to Columbus Near East Side residents, and deputy director of the Ohio State University Clinical and Translational Science Institute. Dr. Joseph is recognized for his work on academic, community, government, and industry partnerships to advance cardiometabolic health through health systems to community interventions, community-based interventions, and quality improvement. So thank you both for joining us today. We are very excited about the presentation, and I'm going to hand it over to Rachel to start us off. So I think you will have to share your slides.
Okay, how's that?
Great. Looks good. Thank you.
As Dr. Shelton is getting started, I think I'm serving as moderator, so please all put your questions in the chat, and we will ensure that we get those questions answered. I think we are all really excited about this wonderful opportunity to learn all about how we can sustain the great work that goes into implementation research. So thank you so much, Dr. Shelton, for joining us.
Yes, thank you. I'm thrilled to be here. This is a topic I'm very passionate about, so it's hard to fit it in this short amount of time, but I am always here to chat or for more resources. Okay, so big picture, the goal today is to define sustainability, especially in the field of implementation science, and why it's critical for public health. And I'm hoping to give you some actionable tools and frameworks that you can use in your own work to think about, track, understand, and plan for sustainability, especially in community settings. And then we're going to think about some of what's known and some of the lessons learned in the field in terms of some of the factors and considerations in supporting sustainability of community engaged or community-led programs. So those are the objectives for today. But first, I want to step back and just tell you a little bit about what brought me to implementation science and sustainability in particular. You can see here in 2009 and then 2026, this same amazing partnership I've been really lucky to have with a group of African-American lay health advisors and cancer survivors who lead a cancer screening program nationally. And I'll tell you, when I first got trained in public health, I was really trained in community engagement and community-based participatory research. And then I got my doctorate in social epi, and I was doing a lot of work on understanding cancer disparities, publishing, getting grants, doing all the right things. But I felt like as I was moving further along in my career, I was having less impact on a lot of the communities that I was partnering with. And so I started to think, are there already community-led or community-based programs that are already out there that are effective, that are addressing some of these health disparities and some of these social determinants of health that we're documenting? So I was really lucky, again, to partner with this group. I had an amazing mentor at Mount Sinai who connected me with the founder of the program. And, I met with them, this is 2008, 2009, and I said, I have all these ideas, we can write these grants together. And they said, that's great. The only issue we really care about is sustainability of our program. They had been in place for 20 years at that time, and they had disseminated the program to 40 states. There were 40 programs across the country. And around the economic downtime, they had lost half their programs. So they said, if we partner and do research together, we really want to focus on issues of how do we support and sustain our programs. So they really brought me to the field of implementation science to try and understand how to answer that question. And we've been working together for 16 years, more broadly in issues of sustainability, but really focused on doing the work because I knew it would matter and have a direct translation to their program on the ground. So I'm really grateful to National Witness Project for this collaboration and advancing this work. Okay, so a little bit about implementation science for those of you who are newer to the field. So implementation science is an area that is developed, at least in the US context, about 20 or 25 years ago, in recognition of this very well-documented gap between research. So all of the investments that are made in developing and testing evidence-based interventions, programs, practices to improve health, And then practice. What's actually routinely delivered in most real world community, clinical, and public health settings? And we know that there's been a tremendous gap. So this field, the goal of it is really about trying to better translate research into practice. And it's really about an actionable set of methods, strategies, and frameworks that really unite around this goal of enhancing the widespread adoption, use, and delivery of evidence-based interventions in real-world community, clinical, and public health settings. So it's not just about the what, not just about the programs, but the how. How do we get it adopted? How do we get it integrated? So where does sustainability fit in there? So you see a lot in the field about implementation, use, initial adoption. What about long-term sustainability? And if you think about kind of our translational science continuum, we often start with the efficacy and effectiveness trials. Does it work? Testing that. And then we get to the implementation piece, right? We get to the adoption, the implementation, and you can see sustainment is tucked in there as the very last phase. And I think that's often what happens. Even, in our research studies, even with the best of intentions, we often don't get to the sustainment phase. And, I've often tried to make the case in my work that it's not really a surprise that we struggle to sustain programs if we haven't been thinking about it earlier along this translational science continuum. So I think if we want to sustain, and especially in community settings or settings where there's a lot of different resource or structural barriers that might impact long-term delivery, we need to be thinking about sustainability up front. And it requires that we're engaging with the communities and the sites where we will be sustaining or partnering to sustain. So I think making that connection earlier is really critical. Okay. So I think if the goal of our implementation science is to actually have systems impact, transformational systems change, or to help support community change around health, we must prioritize a focus on sustainability. I think it's critical. So if you've been involved in any kind of public health or healthcare initiative, you probably know that sustainability can be a challenge. So no matter the health issue, no matter the setting, we find that this is a common challenge. And there's been some research suggesting that only about 40 to 60% of programs are sustained after 1 year. So again, a huge drop off. And sometimes, these are multi-component programs, and even if some components are delivered over time, initially, a lot of them drop off over time. So we know this is a big challenge. And I think, especially for those of us doing community engaged work, community-based work, this is a real challenge because it has huge consequences for partnerships, right? There's a lot of questions around the accountability when people are making the investment of their time around implementation, right? So you do all this training, you build all this capacity to get initial delivery, but then the program's discontinued. So it really results in, I think, frustration among practitioners, public health practitioners or providers, staff, and leaders, and a real questions about the investment that was made around those time and resources. And it can also have huge implications for future partnerships in terms of there might be wariness or mistrust to engage in future efforts. So I think it's really, really a critical issue for community engaged work in particular. And we know that sustainability can be, it's not even, right? Settings that have a lot of resources, a lot of infrastructure are more likely to sustain. So I think it's really a health equity issue as well. So if you can launch the first poll, I'd just love to know and hear from you all a little bit about your experiences with sustainability. So have you ever experienced challenges in sustaining health-related programs or interventions in community settings where you work? Are there any results? I can't see them. Oh, okay. Wow. Yes. So this is a huge challenge. So wow, that's a lot of us. So this is a common experience that we all have. Thank you all for that. Okay. So what does sustainability mean? When I first went to the literature to look into this 15 years ago, there was a lot of associations between sustainability and funding, which we'll talk about, which we know is important. But really, sustainability is multidimensional. And a lot of times when we're talking about tracking sustainability or thinking about sustainability, we're talking about, does the program continue? What's the extent to which the original program or practice or intervention continues to deliver over time? And it may also include, how is it adapted to adjust to changing context or needs of the population? It's also about, what's the continued health benefits or outcomes or behavior change that we see. If it was a program that originally was focused on, diabetes screening, do we see that same level of benefit over time after 1 year of delivery versus 5 years? What are the partnerships that were in place initially that were essential to kind of launch this program and its implementation? And have they been maintained in terms of networks, partnerships, or infrastructure? And then, are there any indications that it's been institutionalized within an organization? So are there, any documentation where it's been kind of routinized as part of budgets or a line item, or specified as part of someone's roles and responsibilities? So are there indicators of institutionalization? And often we might think about tracking sustainability using multiple dimensions of sustainability. And I love this definition that's been introduced in the field that kind of also captures some of the dynamic aspects of sustainability. This notion that after a period of time, and often people might say at least a year after the intervention has initially been delivered. So, 2 years, 3 years, 4 years, the program continues to be delivered, the outcomes or behavior changes maintained, but it recognizes that the program may evolve or adapt while continuing to produce benefits for individuals and systems. So this notion that, sustainability is not a static end goal, that we're going to reach it, we're going to check it off and say, we're done, we've sustained, right? It's also about understanding, how do we need to evolve and adapt the program over time to continue to sustain it in changing context. So a lot of times people think more about these dynamic notions of sustainability over time. Okay. So as I mentioned at the beginning, I think it's really important that we're not kind of approaching sustainability as a tag on. We get to the end of year 5 and we say, oh, we need to be thinking about sustainability. So I think it's really critical we're planning for it up front. So what can that look like? And as I said, it really requires, again, that we're thinking early, not just in the initial implementation phase, but even out front as we're thinking about what's being delivered, right? That will have huge implications for what is actually able to be sustained, so that we're really connecting the dots from the outset in terms of planning for long-term sustainability. So there's this notion of designing for sustainability that people sometimes talk about. And that really just means, how are we early and on an ongoing basis engaging with all the key partners at all different levels that are critical to have their buy-in and perception about how feasible, how acceptable, how sustainable is this program, right? So that includes leadership, that includes practitioners, providers, community members, patients. It may include policymakers. So this will all be really specific to our setting, but really thinking about engaging early about their perceptions and any barriers that they would see. That we're not selecting interventions to deliver that are really complex or costly, or that we don't have the capacity to deliver. Are there ways it could be integrated? Are we thinking about sustainability in the selection? And are we engaging the right people in that selection? So I think that's critical as well. Does it align with the patient and community needs? Is it a priority? And we might also want to think about that broader alignment. If it's being embedded within a larger organizational infrastructure, how does it align again with existing priorities there? How does it fit? Are there opportunities for integration within existing programs? What are some of the policies in place that might support it? So that policy and kind of systems alignment is really critical. And then we also have to think about and understand what are some of the specific barriers to sustainability that we need to be thinking about up front. So when you look at the literature, you find that, again, a lot of the factors that impact sustainability do relate to funding. We know funding and resources are absolutely critical. But we also know that sometimes funding isn't enough. And we also know that sometimes other factors can help compensate for limited funding. So other factors, again, just like implementation that impact sustainability, again, relate to what are some of these external partnerships? What are some of the external policies? What are some of the issues around financing or reimbursement that might impact sustainability? What's the extent to which we have leadership buy-in or champions within our organizational setting? Do we have the capacity organizationally to support this? Do we have an integration into our workflow? Do we have the staff to do it? Does the evidence fit for us, right? Does it make sense for our population? Is it cost effective? Could we refine it? We know that interventions that are more adaptable and where settings can have more ownership are more likely to be sustained. And then do we have the delivers and do they have the capacity and motivation and support around delivering it? So all these are critical for both implementation and sustainability. But we also know there's some additional factors that we have to think about with sustainability because of that dynamic nature of time, right? What happens over time? So some additional issues that sometimes come up with sustainability are the changing policy landscape, right? We know there's huge implications for what happens on the national, state, and local level in terms of policies and impacting programs, right? A new leader comes in at a hospital or clinic or public health site, right? That can really shift priorities and programming. So changing priorities is a huge issue. We also often think, kind of year to year with our budgets. And there's not always evidence or data up front to say what the return of investment will be for a program to sustain it. So sometimes we have limited data or limited information to kind of make the case to invest in a program. And then we also know that attrition is a huge, huge factor that impacts sustainability of programs, right? And that's at every level. That's at the provider level, that's the practitioner, implementer, and leadership turnover and attrition. Those are tremendous issues. And maybe it would be good to launch the second poll now just to hear from you all about some of the factors that you found might be most important for sustainability. I'm sure there are many others not captured here. I wish we had another write-in. I'm very curious. Let's see. Oh, yeah, funding, huge, 65%. Lack of organizational infrastructure, yep, almost 20%. Right, it's not about that it's not a beneficial program, right? We know it works. The attrition about 6% and limited leadership buy-in. So yes, those funding resources and organizational infrastructure, we have found the same thing is absolutely critical. So thank you all for that. Okay. Okay. So now we're going to move a little bit into some of the tools to think about in your own work. So maybe almost 10 years ago, I did a review with colleagues of the existing literature across multiple types of settings, global work, community, clinical, public health, schools, workforce, health systems. And we tried to see, are there common factors that seem to matter for sustainability, no matter the setting or population or intervention? And we came up with this integrated sustainability framework that we published. And the idea is that this would not be every factor you would matter. This would not be really prescriptive for your program, but this might be a starting place for you to start to do some formative work, to start to ask some questions, to think about how these might impact sustainability for your program. So to really tailor it for your own setting. And we've done that in our own work. So we developed a qualitative interview guide that's available in this practical implementation science book, and I'm happy to share the guide and the chapter. But at each of these levels, the policy, the organizational, the implementer, we have different questions to kind of ask about, what are the policies and broader norms in place that might influence sustainability? What's the broader funding environment like? Are there external funds to continue sustaining the program? What are some of the partnerships in place? And how might those resources help support sustainability? How does the intervention align with existing state, local, and national priorities? So again, at each level, to kind of use this internally on a team or with partners to kind of understand and plan for some of these issues. There's other great tools as well. So I highly, highly recommend sustaintool.org. It's a website and resources developed by Doug Luke and colleagues at Washington University. And they've created great resources both as a measure to kind of assess capacity for sustainability, and also kind of a planning tool that can be used. And there's a clinical version, the Clinical Sustainability Assessment Tool. I've mostly used the public health version, which is the Program Sustainability Assessment Tool, the PSAT. And it has these different domains. It's about 40 different items, getting at a lot of these same issues we've been talking about: partnerships, funding stability, organizational capacity, evaluation, strategic planning, environmental support. So this is a great, great tool. And honestly, the way that I have found it, I have used it as a measure. The way I've found it most useful is to elicit input for people to actually use it at community sites. So the Lay Health Advisor programs that I've partnered with, we give them this data back so that they can say, oh, we've all, the 9 of us, the lay Health Advisors and project directors at our site, we've really identified that we're really strong already on program evaluation, but we really need to focus on new partnerships and funding. So it can kind of identify and pinpoint some areas where it might be important to kind of build more capacity for sustainability. So it's great. Highly recommend these tools. And this website's really user-friendly. So really encourage you to take a look at those.
Rachel, we have a question about
Of
that.
course.
Um, the program sustainability assessment tool,
Mm-hmm.
one, who is it available to?
Mm-hmm.
And what is the kind of learning curve onboarding to that tool?
Pretty straightforward. So it's freely available. These are all downloadable free tools. The measure, if you use it as a measure, you can use those items, and the scoring and everything is available. If you use it as a tool like this, just downloadable, it's almost like a PDF report. They keep updating that and making it more user-friendly. It's available in English and Spanish. And now there's also different tools that kind of map onto it. So say you find you need to build capacity in certain areas, here are some resources to think about that. So again, available to everyone and pretty, in my experience, pretty user friendly.
And talk a little bit about how people utilize that sustainability report in their own work.
Absolutely. Here, I can show you this. Let me go down. Let me go back here. So what we have done with the 16 Lay Health Advisor sites that we partner with, so we give them all the data. So they'll get all the PSAT scores and they can look over time, okay, here, over time, our site, we decreased in all these 3 years, right? And we see here again that we're pretty strong in this area of partnerships, but less strong on funding. So we're going to think about prioritizing a focus on that. And we can do some interesting visuals. I've had great students work with me at Columbia who help create the reports for the community organizations to help visualize it, right? So again, really strong here across the sites on program adaptation, but again, needing to focus more on funding and strategic planning. So it helps people prioritize areas. You can't do everything. Where might you start? And it gives an anonymous perspective into how the implementers or how a site feels, right? Without having to kind of say it out loud. It's like, oh, here's what the data says around this. This is probably where the team thinks we should focus.
That's very helpful. Thank you.
Yeah. Okay. Where was I? Okay. The other area that I think is really important and interesting is, so much work in the field of implementation science is focused on implementation strategies. How do you get something up and running? But a lot of those strategies may look a little different over time for long-term sustainability. So we've made the case that we might have to think about additional strategies for sustainability. So not just training, but train the trainer approaches, right? Might be more appropriate if we're focusing on long-term sustainability. There might be things that we might think about to support sustainability, like revisiting MOUs or funding or contracting with leadership at organizations to sustain a program. So just because you have an initial contract, if the leadership changes, right, we might need to re-engage what that looks like and what the expectations are. Also issues around succession planning. We've talked a lot on our teams around maybe more shared leadership models or succession planning to help address some of those issues around attrition and what's in place when you do lose staff or there's leadership changes. So again, a lot of this literature is still emerging, but I think there are some growing lessons learned in terms of strategies we can apply to proactively address and plan for sustainability. And I've put some examples here about this work. Okay. And then last but not least, this is not always possible. I know sometimes the evaluation piece can be tricky, but it's really useful to understand, I think, over time when possible, especially if we can work from existing metrics or administrative data, indicators that give us insight into what's happening with sustainability. You may be familiar with the REAIM evaluation model. This is a wonderful model that helps us get at different aspects in terms of implementation, reach, adoption, effectiveness. And then we have maintenance, which is kind of tucked in on the end. And as I said, often we don't get to it, right? We might do a 6-month follow-up. It's often not that longer term maintenance and delivery. And often also when we use REAIM, we also don't really track where and when the gaps emerged, right? We might just get to the end of the study and say, oh, it wasn't sustained and there are inequities, but we don't know where along this pathway. Was it because it wasn't equally adopted across different types of organizations? It wasn't fully implemented, it didn't reach the right population, or it wasn't maintained. So we've also done some work on taking the original REAIM framework and having a greater focus on planning for long-term sustainability and understanding where those gaps and challenges emerge, especially related to health disparities and health inequities. So we've taken each of the REAIM dimensions and put a greater focus on identifying where the challenges to sustainability and where the inequities are kind of exacerbated at each of these phases. So this is a paper that we did, and happy to share kind of the qualitative questions and some of the indicators that that we've worked on to help capture some of that. But I think it's important when possible to try and track what's happening in terms of long-term delivery of the program and why some of those challenges are emerging. Okay. So that's a lot in terms of kind of big picture introduction and some of the tools and frameworks and things you might want to think about, considerations for sustainability. And I'm going to share now a little bit about some of the lessons learned in our collaborative work in the last 16 years around sustainability. So a little bit about how we approach this. This has been a long, a long time, and some funded work and some unfunded work. But in the initial work, we just kind of did some groundwork, informative work to understand what was happening at sites nationally with the National Witness Project in terms of why they were having so much attrition with lay health advisors and with programs becoming inactive. So we did some qualitative work at about 8 of the sites across the country to really understand, again, using that integrated sustainability framework, what all the factors were at the organizational, national partnership, implementer that really impacted it. And then we created a framework together called the Lay Health Advisor Sustainability Framework that really tailored their specific experience in terms of what they thought was impacting sustainability. So everything from the partnerships with academic and community organizations to the nature of unstable funding to support it, all these different issues at different levels. And we knew all of these were important, but we said, you know, which of these factors actually might predict long-term sustainability? So we received some funding from the American Cancer Society. We had 16 sites across the country engaged with this work from the Witness Project. And we tracked different indicators of whether or not the program was still active, were they still delivering the program, how many lay health advisors were still active, and was it being maintained over time. And we found, really interestingly, huge variability in terms of sites. Some sites were highly active, some sites were active one year and not active another, and some were kind of consistently lower activity level or inactive. And so we tried to understand what was happening at these sites that was different. And what we found, again, pretty consistent with what you all were saying, is the outer context, right? The partnerships that they had, the nature of alignment and support of external funding, and its focus on health equity and mammography screening in particular was really critical, because all of that then influenced that organizational infrastructure, right? Their ability to have the infrastructure and space and support to deliver the program. And have that leadership and to support delivery of the program. So again, the external and kind of that organizational context was really critical in supporting sustainability of these programs. One thing that I think came out loud and clear in both our qualitative and quantitative was that a lot of these programs really had very strong and sustained partnerships that helped them address a lot of the resource limitations or challenges they had when they couldn't get funding or when funding wasn't available. So everything from helping provide referrals within the healthcare system for free mammography screening to helping provide space and access to printers or cover gaps in terms of supporting the lay health advisors' time and stipends. So those partnerships that they had with both other community organizations, churches for space, for example, and healthcare system or university partners was critical for those sites that were able to sustain. They also found that a lot of the organizations moved from being embedded within organizational and university settings to being standalone community programs. Many found a lack of alignment and support within the organizational infrastructure of a university or cancer center, and found that they were able to establish nonprofit status as a 501c3. So many of them have moved to that model to support better sustainability while still keeping some of those relationships. We also found that training is a huge mechanism for sustainability over time because it builds that support, that motivation, that social network, and that connection at the sites, and really that value that keeps many women in this program. So that ongoing training and the train the trainer model was critical. And we also found that the programs couldn't be static, that it was critical that they adapted to changing contexts. We did this work during the pandemic, and we found that many of these programs had to pivot. They had to address issues around food insecurity, housing insecurity, before they could get to mammography screening. So again, thinking about changing context and how to adapt the program to help support those health needs over time is critical. And then again, this notion of what is the succession plan for leadership? It's not a conversation that everyone wants to have. It's a hard one, but really thinking about, we know how important that is for sustaining a program. So having plans in place for succession or for shared leadership models over time, I think can be critical. Okay, I'm going to skip some of that. And I showed you all. So again, we gave all the data to them, and this has been really useful for them in writing their own grants and applying for funding at their own sites across the country. So this is something that we continue to do on an annual basis and give back so they can understand the gaps and needs over time. The other thing that we have done based on this kind of barrier data and this data on where they felt like they needed to build capacity is we've also said, okay, are there strategies we can actually put in place to address some of these gaps? Are there things we can do to actively address them? So we heard from them, what do they think would be the most effective and also feasible strategies to support sustainability of the program? And we heard, everything from adapting the program to meet community needs to, identifying new community-based organizations to partner with. A huge win for the groups has been building a community of practice to learn from and exchange information with other sites about what's working or not with respect to sustaining the program. Having, again, ongoing training, identifying partners or champions at academic or healthcare systems, and providing kind of technical assistance and office hours by the national leadership of the program to support it when they have issues around turnover and attrition. So these are some of their ideas in terms of what they thought would be critical to support sustainability. And we were lucky enough to build a grant that addressed these strategies. And we're now in the middle of a study where we're actually testing, do these strategies work in supporting sustainability? We are focusing in particular on taking an entrepreneurship business model that was tested originally for NIH researchers. And we're trying to understand, can we adapt that for community-based organizations to impact sustainability? Because it addresses a lot of the barriers that they identified in terms of not knowing how to identify partners, not being able to build the business case for the program, and not knowing how to kind of make those connections with resources in the community. So we are right in the middle of this work and really excited to see how that will impact sustainability over time. And I think at the end of the day, a lot of the work on sustainability comes back to relationships, partnerships, and resources. That is a lot of what we're learning from the sites, and really trying to understand, how we can learn from them in terms of what those partnerships look like, how they build them, and kind of how the exchange of some of that resources and support happens. So that's some of the work that we're doing moving forward. Okay, so hopefully for you, this has been useful to kind of think through, for your own work, what is it that you're seeking to sustain? What would success look like for sustainability? What are some of the factors that will matter most in terms of sustaining your program, right? And often there might be some maybe literature already out there on this, or you can do some, formative work, informal work, and conversations to understand that from the perspective of different people in your setting. And then really thinking about if you're to do something actively to try and address some of these challenges, who do you need to engage? What are, who are some of the partners? What are some of the conversations that you need to have? So hopefully these are some lessons, some helpful kind of lessons learned on our end, and some tools that you can think about applying in your own work. There's lots of work. I'm happy to share any of the resources I mentioned. Just reach out. I can share some links or some of the chapters if it's helpful. I really want to thank the Witness Project and all the team members, Dee Johnson, and collaborators on that, as well as the research funding from NCI and the American Cancer Society. And I want to thank the partners. Here's the original group of the founders of this program in 1990 from Little Rock. So I always like to honor these women as well. So thank you so much.
Fantastic presentation, Dr. Sheldon, and to be able to do that in a little over 30 minutes is absolutely amazing and incredible. I learned a lot just from the delivery of the talk. One of the questions in the chat is around the ERIC strategies
Yeah.
that were put forward. And for those that are less familiar with this area, these are the expert recommendations for implementing change. And how in a program that may have been in existence for a while, but are not yet, it's not yet kind of widespread, and looking for ways to increase reach as well as longevity. How do you utilize those tools? Where do you start? I know kind of what I heard, but I would love to hear from you kind of on that, and then we can kind of talk a bit about that.
Yeah, that's a great question. So interestingly, there was a lot of questions in the field about, are the same strategies for implementation relevant for sustainability? Um, and not a lot of empirical evidence around which strategies to use for which different kind of phase of implementation. So we did a bit of so we worked with the original developer of the ERIC taxonomy, that original group. And some colleagues in Australia took the lead on revisiting all the ERIC strategies, but trying to group them by where are they most relevant? Is it in the exploration phase using the EPIS framework? Is it in the exploration phase? Is it in the preparation phase? Is it in the implementation phase? Or is it in the sustainment phase? And I think that is a useful starting place, because I really think some are relevant throughout, like engage consumers or engage partners. Like that to me, you need to be doing that across every phase. But there's some in terms of like, I'm trying to think about one that might be different. Well, the ones around sustainability, like building a community of practice, right? That to me is one that you wouldn't necessarily do that in the initial, oops. Are you still there? Oh, I lost you.
Yep, we're here. Yep, yep.
Um, That's one that might be a little bit in the later implementation phase or the sustainability phase, right? So you might imagine that different ones are more useful across different phases. We found that a lot of them had to be reworded. Well, Byron Powell wouldn't say this, but I found that when he developed it, we were a bit like this, butting heads in terms of whether or not they everything fit for sustainability. I thought a fair number of things needed to be reworded or reframed because they don't capture the time element.
Okay,
And so it's not just training, right? You can
got
have
it.
an initial training to get people on board for adoption, preparation, maybe implementation. But for sustainability, you're not talking about just training, right? It's like train the trainer. To build that and to institutionalize that, to me, the time piece is different, right? It's
Got it.
not just funding, and maybe creating an MOU. It's about revisiting that when the leadership turns up, right? So I
Right.
think the time phase is actually really important in terms of the framing of some of those strategies. I don't think the literature's there at all in terms of the evidence of which works for which phase. Like that to me is we need to do that. There's just been a lot of focus on the implementation phase and what different combinations of strategies help support, interventions, reach or uptake, not much on the sustainability phase, and other phases. So I think that those are really critical gaps. But I'd point them to that paper. I'm happy to share it, that where we did the concept analysis and kind of reformulated where they might be most useful, which strategies might work best in different phases.
And, as a follow-up to that question, when I look at that program sustainability assessment tool,
Hmm.
it seems like that for a program that's in existence, that's a great starting point to maybe even determine where you need to go on that second component. Maybe you could talk a little bit about that.
Absolutely. Absolutely. So the field, as you probably know, we do a lot of work on barriers and facilitators. We have
Mhm.
all the frameworks, CFIR, PRISM. So PSAT and CSAT, the Program Sustainability Assessment Tool and Clinical Sustainability Assessment Tool, are a little bit like that, right? So you
Mhm.
understand where are those barriers and challenges, but then how do you get to that next phase, right, of then
Yeah.
addressing them? So we've tried that in a couple different ways. I think one is I think the PSAT was really useful for us in getting consensus across the 16 sites of where the challenges were, right? We
Okay.
started to see, okay, we're hearing again this notion of building partnerships and not knowing to do that, right? We see again this case of not knowing how to make the business case. We see again the importance of champions. So we started to see across the PSAT that certain things were rising to the top across all the sites. So that was a good starting place in terms of limiting that list of like 100 barriers to like,
Yeah.
okay, these are the more, and also what's actionable, right? We're not,
Right.
um, so that can help you limit and kind of prioritize those barriers and share. Is this right? Like, does this speak to your experience, right? Are we getting these right? And that's where we then said, okay, let's hear from the sites about what strategies they think. So that's when we asked them about the sustainability strategies. What did they think would it take to help support sustainability? And then we did a little bit of mapping. Okay, so this strategy, like the community of practice, this would help address this challenge of understanding from other sites on how to address barriers, right? So we did a little bit of the mapping of what we learned about from PSAT to what they suggested would work as strategies. We did not use kind of the strict ERIC taxonomy. We kind of then saw how that aligns with, our approach is community of practice, our approach is training, our approach is technical assistance. Those are all ERIC strategies, but we were much more kind of focused on what's the biggest challenge we're learning from them from the PSAT. What do they think will help address that? And how can we align that with the strategies we're kind of putting together and testing? So a little bit of kind of there's no perfect process. I think people do a lot
Yeah.
of different approaches on trying to prioritize and rank and match. But we tried to really involve them and their insights on what they thought would be important and feasible and effective.
Got it. Got it. Let me go to another question here.
Yeah.
And this comes from Anthony Salandi. I said I use the PCORI model when thinking about sustainability. That is, who should be at the table when thinking about projects or programs. As a CBO, a community-based organization, when I look to partners in sustainability for evidence-based implementation or interventions and programs, I bring payers to the table, both to establish referral systems and move forward towards value-based contracts. This in addition to clinics, FQHCs, and other CBOs, et cetera. Can you discuss a little bit about the role of payers? And I'll add to that, potentially bringing them to the table from the beginning.
I love that. So our community partner, the lead community partner for Witness always says, who's going to pay for it? That is always the question that she asks for anytime we talk about sustainability. And I completely agree that payers have to be at the table. So part of this entrepreneurship program that they're learning is they are learning to identify all those different people who could help
Mhm.
bring some of those resources, and payers are one of those critical pieces. So some of it is kind of understanding where is the need and service, and how might you address it, and are they willing to pay for it, right? And I can tell you the story of the national group, the national leader from Witness that we partner with. She partnered with the original founder of Witness to get one of these small business grants from the
Okay.
NIH, this SBIR, I think it
FBI.
was.
Yeah,
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 yeah.
yeah. And they went through this entrepreneurship program, and they realized that the biggest potential payer for them was insurance companies. They said, we're providing this whole screening out. We have this network of women that they value, that they're, incentivized to reach,
Mhm.
and it'll impact their reimbursement, and they're now being accountable for this. So they ended up creating a small business plan for navigation that was adopted by Molina, the insurer, across the
Wow.
state. So they were able to scale their navigation services with an insurer, with a payer, by going through this whole process, just like you said, who's at the table, and doing some of that work to identify kind of the gap and the need, and the service. So I think that's critical. I think sometimes, though, organizations don't necessarily know who all those people are to be at the table. Who are those payers, right? How do you
Right.
identify them?
Mhm.
So I think that is some of the lessons learned that I think our sites are working now on. How do you identify those people? How do you reach out to them? What questions do you ask them? So I think those are some of the things that you might not necessarily be taught, and might have to learn on the job. But those are some of the skills that we're teaching through this program, is around identifying those payers, and communicating with them, right, as a
Love it.
potential support for sustainability.
I love it. I know within CEDER, there's resources to do a lot of this and to help figure out some of those really tangible goals and targets for sure. I'm gonna try to get to two more questions. We may just get
Okay.
one. I'll try to get to two more. The next one and is it says just a super practical question.
Yeah.
Can we really sustain without financial resources? Do you have examples of sustainability of specific efforts that have continued in the absence of funding? I think that many settings and programs are struggling with this in the current context, given disinvestment from different payers, different organizations,
Yeah.
in the reimbursement opportunities and grant funding.
Oh, it's a huge, huge issue. And I think it's so much more widespread right now, given the current context. Yes, I do have that from the work that we have done with the sites nationally. We do have examples of programs that sustained despite not having funding. But there's a couple caveats. Sustained for how long, I think, is part of the question, right? So often those might be the sites that might be inactive for a year and then come back, or they might stop delivering the program and pivot and then come back. Those sites tended to have really strong university and healthcare system partnerships. So when they had no funding, so Komen, a lot of the breast cancer screening funding has been eliminated in the last 10
Mm,
years. Huge change in the landscape in terms of the funding that these programs historically had versus what they have now. It's no longer been a priority. They have really had to pivot for that. So sometimes it's about, okay, we might not have our own physical space, but we have this partnership where they're now going to allow us this space. We have access to their printers.
mm,
Maybe our project director is involved with the department, or some nonprofit or a role where this is one piece of her role, but not the full one. So we're able to leverage some of the resources and support there. Maybe we have a pastor on board who's able to leverage some of the resources with church donations or fundraising. So kind of piecing together those resources temporarily. And I will say, you might see that being able to be done for a year or two, but it's very difficult. I think it's very difficult once that funding goes away over a long period to cover
Okay.
those gaps.
Okay.
But those partnerships, community and healthcare and university have been critical in that. And then sometimes they have pivoted to other related areas. So maybe providing a similar service, but maybe for a new area. And so
Okay.
getting grants and contracts in area, it might not be mammography. Maybe the priority now is colorectal or diabetes prevention or, so similar model, but maybe now applied in a new area where there are temporarily more resources or support. And then we've also seen that sometimes there might be coverage through, we've even seen like peer-to-peer coverage of programs. So temporarily they're having challenges covering space or with ordering resources. And so other peer programs might also support. But again, often that's, long term, that's hard to do.
Emma came on, so I imagine
Oh,
that
is that our
means
sign?
I probably do not have time for my last question. I'll throw it out there. You don't have to answer it
Okay.
because I think Emma's going to take it away here. But I think my last question was really around trust and relationships. You mentioned it; those two words probably 10 to 12 times during your talk. And maybe just briefly, just describing how you engender those successfully. And when those transition, how do you transition with that over time?
Oh, wow. In a minute. That's a hard one. No, but I would say that's been critical, I think, to the sustainability, not only of those programs, but also to the sustained partnership piece, right? And that's critical to be able to do this work, I think, across any community academic partner. So I think what that's really about is not coming in, I think, with your own ideas about what this is going to look like or what you're going to focus on or how, it's about being at the table with community partners or whoever the partner is, whether it's, any kind of partner, and that it's the decision making is shared, the resources are shared, the priority in terms of what the outcomes we're going to track or what this looks like or how, I remember one time I had a project coordinator say, we're spending a lot of time talking about what the gift cards are going to be. Is this really, I was like, yes, this is critical. Like it's
Yeah.
all those like really small things that aren't actually that small that I think are critical for building that trust and those relationships and like when in those periods, I think in the 16 years where we didn't have funding, like still showing up and saying, okay, what can we do? Like, it's very bi-directional. And I think that bi-directional, still showing up, giving the data back, all those little things along the way are really critical.
Perfect. Thank you so much for just a tour de force hour. I mean, this was absolutely incredible. And with that, I'll pass it back to Emma.
Thanks.
Thank you. I'm so sorry that I'm the bearer of bad news during this amazing webinar. Thank you, Dr. Shelton, Dr. Joseph, Dr. Chambers. This is just phenomenal. And we really hope this is just part one of a long conversation with everyone on this webinar and all of CEDER clients and partners, et cetera. I will say, before I jump into my slides for 1 minute, that we are hoping to organize another learning exchange specifically from the perspective of our community partners that are part of CEDER and their work. They've been doing community engaged research and programs for a very long time and have a ton of experience in this area. And so we're hoping to plan that for the fall. So please come back. But with that, I'm just going to share a couple last slides. This is so hard to close out such a great conversation. Hold on 1 second. Oh gosh, what's happening? My slides are not. Here we go. Okay, so with that, we'd love to hear from you. Please take 1 minute, 2 minutes to fill out our evaluation. We're always thinking about how to improve these events. We will also circulate this link afterwards. As Dr. Islam put in the chat, Dr. Shelton, Dr. Joseph, Dr. Chambers, everyone on this call in this webinar is available to meet with you as part of their work with CEDER. Again, we provide free consultations and studios to support your work. It's really providing advice and support and connecting you to others across the country who are leaders in sustainability and a variety of other topics related to community engagement and type 2 diabetes. It's a very easy process. You can go to this QR code. It should take you about 2 minutes. We just got a request during the webinar, so we're really excited from the University of Texas, but please reach out. These are obviously phenomenal people and really would love to help you in your work. And here are just a couple ways to connect with us if you aren't already. We have a pretty active LinkedIn page. We always share events and resources and information there. We have, again, other webinars coming up. We're going to be planning one hopefully for July, and then we'll have them starting back up in September. And then we also have a quarterly newsletter. And as Dr. Chambers mentioned, we do have a YouTube channel with all of our past events. So please make sure to check out all these things. Please connect with us. We'd love to hear about your work and partner with you in the future. CEDER is a wonderful group of experts and leaders from the community, from the research community, et cetera, who are excited to meet with you and connect on your work. And with that, thank you. Check out our website and have a wonderful afternoon. Thank you again to our speakers.
Thank you all.
Everyone.
Thank
Take
you.
care.
Bye-bye.